Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. Today's focus is going to be on fluid volume deficit, cardiac focus, and part of my Surg camp and cardiac camp. A lot of these concepts are focused on my nursing labs books, my Cracking the Code on Cardiac, and also my Pocket Clinical Guidebook. Most of my sticky notes can be found on Instagram, Facebook, Pinterest, and Etsy and nursingkamp.com. We got a lot to cover, so let's get going. Okay, first thing, fluid volume deficit. Well, what is it? Well, there's not enough fluid in the vasculature. Okay, so there's three types of fluid volume deficits. One is an isotonic deficit. Isotonic meaning that there's not enough fluid going in, or solutes, or there's fluid shifts going on, like third spacing or something like that. Or there's excessive loss of like sweating. Next one is a hypertonic. I go more into isotonic, hypertonic with my IV fluids lecture. Please see that. But this is about excessive perspiration, or it could be an underlying condition like ketoacidosis, or fevers, diarrhea, and end-stage renal disease, or diabetes insipidus, covered in my Surg lecture. Okay, next one is the last one, the hypotonic dehydration. Usually the result of chronic illnesses or excessive fluid replacement, mainly hypotonic fluids, and also chronic malnutrition. Okay, let's get into it. Well, when we're looking at cardiogenic fluid volume deficit, you always have to assume that the heart is working fine. And the reason I say that is because we're talking about the fluid volume deficit. And we're not talking about somebody in cardiogenic shock or a previous MI. What we're measuring is this fluid volume. Now, to understand fluid volume, we need to look at blood and the plasma. And plasma is about 55%, and that's the fluid portion of the blood. Then you have the white, fluffy, buffy white, which is the WBCs. Then you have 45% is your RBCs, your formed elements. What we're really talking about is this fluid. So peeing, puking, and pooping causes fluid loss. And when we're looking at fluid volume deficit, what's going on with the heart? Well, the heart is normal, so it recognizes that there is a fluid loss, so therefore you can have an increased heart rate. And that's part of my most patients do wish lecture, where I talk about dehydration as a cause to increase heart rate. And heart rates greater than 90 are acute. That's the boat coming. And what I mean by the boat is I mean problems. Meaning that seeing the boat coming, recognizing that on the horizon is a boat, is the heart rate is greater than 90. Because why is a person sitting in bed with a heart rate greater than 90? Anybody can see 100, but 90, that's acute. So once we start to see heart rate in questions, it's about heart rate, and most patients do wish. Please see that lecture. Okay, let's get into the physical findings. So when we're looking at the heart, we're looking at the cardiovascular system and the body. And when we look at the body, we'll start with the pulses first. So in the pulses, because there's a fluid volume deficit, when we check on a radial pulse, and we put our finger on it, we are going to have a thready pulse. Okay, because we can't feel the fluid, and so you're going to have this threadiness going through the pulse. And that's a normal finding, because normal findings for that is that you're feeling that this is assessment. So assessment with the thready pulse is dehydration. Okay, decreased blood pressure. Because there is a decreased volume, they're going to have a decreased blood pressure. In response to that, the heart rate will increase. Now, blood pressure, we want a mean arterial pressure greater than 60 to 65. And I cover that in my hemodynamic lecture on how to figure out the mean arterial pressure. But what this means is if it's greater than 60-65, they're perfusing their kidneys. Okay. Now, decreased blood pressure is a first sign and symptom that they might be dehydrated. Actually, heart rate will be you'll see first. But because of this fluid volume deficit, we're going to do what's called orthostatics. And orthostatics are important because orthostatics are basically a method that is used to figure out is there a fluid volume deficit. Now, I cover orthostatics with blood pressure pills in my cardiac camp, but this is about with fluid volume deficit. And the principle is this: if the fluid volume is low, when they move up in sitting position, if it's low, the body can't really handle this, and the blood just kind of swishes and they get dizzy. That's a cue. And that is called 20-20-10. 20 changes systolic, 20 changes diastolic, and 10 changes in the heart rate. And that's a variance. If you have a variance of anything from lying to sitting and then to standing. And if that is positive in these areas, one of these areas, they're orthostatic. That further confirms dehydration. Okay, the next thing is flat neck veins. Okay, well, that's called JVD. When we have JVD, we're talking about fluid volume overload. And what that is when a person is sitting in the 45 and you press onto their stomach, you should see jugular vein distension. That's too much fluid. Okay. So that means that flat neck veins is too little, decreased fluid. The next thing is diminished peripheral pulses. Now, diminished peripheral pulses in the feet is that we said in the radials, if you feel a thready here, it's thready, that means in the peripherals they're really going to be sometimes even absent because you can't feel them. So if you can't feel pedal pulses or they're weak, you might need to get a Doppler. And a Doppler, if you can't feel it and you need a Doppler, you can generally question, is the mean arterial pressure greater than 60? Because if you're using a Doppler, it's either, and the Doppler is a ultrasound, and it makes a sound. I know that's pretty awesome, right? So that is decreased peripheral pulses. The next thing is, also, if you can't feel the peripheral pulses, it might be edema too, and that could be fluid overload. But we're talking about dehydration. The next thing is a CVP, a central venous pressure. Now, central venous pressure is a catheter, and it's put into usually the jugular or wherever. And what happens, not the jugular, it goes into the heart right above it, and it measures. In a normal CVP, you can see that in my hemodynamics lecture, it's 4 to 8. It's actually 0 to 8, but testing-wise, 4 to 8. Less is dry, and greater than is overfilled. Okay? So the principle is this. See the volume peripherally. Peripheral. It's the volume outside the heart, and it's assessing that. That's also the wedge pressure. Peripheral artery wedge pressure. What that is there's a catheter that goes in to the heart, and it goes over into the pulmonary artery, and where it measures this pressure, or left atrium. And that's more acute. How you figure out the wedge pressure, you can see it in my hemodynamic lecture, but you take this 8, so it's 8, and you add these together, and that's 12. So 8 to 12 is your wedge pressure. Greater than 12 is too filled, and less than 8 is too dry. So when you're looking at hemodynamics, you see a CVP or wedge pressure, it's about fluid, and it's about the status of the fluid. Now, the heart is always going to be functioning normally if the patient is just dehydrated and there's no cardiac comorbidities. So when we're talking about dehydration, the cardiac is going to recognize by increasing heart rate, decreasing blood pressure is a response. Also, CVP wedge pressures are also hemodynamics that we assess fluid volume. If we don't have those, we can do pulses. They could be thready. We could have diminished pulses on the peripherals. Well, that concludes my Nursing Camp Med Surg Camp on fluid volume deficit, cardiac focus. You can follow me on nursingkamp.com, Instagram, Pinterest, Facebook, and we'll see you next time, where we cover respiratory and neuromuscular.